Welcome to the Courageous Public Health Podcast. I'm Dr. Kristi McClamroch, and I am so glad that you're here for this very first episode. Before we dive in, I want you to know this podcast isn't just about public health. It's about courage. It's about showing up fully, even when it's uncomfortable. It's about daring to lead, to dream, to disrupt, and to take up space, especially for Black, Indigenous, and women of color working in public health who have been doing this courageous work all along. In today's episode, I'm pulling back the curtain. I'll share why I started Courageous Public Health, what courage really means to me, and how my personal and professional journeys are deeply intertwined. Most importantly, I'll share why I am committed to standing on the legacy of courage, resistance, and leadership that BIPOC women have carried for generations. So take a deep breath. Let's step into the space of courage together. Here is episode 1. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Kristi McClamroch. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Welcome to the very first episode of the Courageous Public Health Podcast. I'm Dr. Kristi McClamroch, founder and CEO of the Courageous Public Health Consulting Firm. I'm so excited to be here today. And you know what's funny? I'm also terrified. So many thoughts are racing through my head right now. What if the podcast isn't any good? What if no one listens? What if I'm not enough? Not articulate enough? Not smart enough? Not engaging enough? What if? Thank you, brain, for trying to protect me. But you know what? I got this. The title of this podcast is Courageous Public Health. And this is a great opportunity for me to be courageous, to feel my fear and hit that record button anyway. I always remind myself that courage is different from bravery. Bravery is about taking action without fear. Courage is about taking action despite fear. Okay, so why a podcast about courage? It's in the name of my business. It's in the title of this podcast. It's on my necklace. It's even tattooed on my body. Because for me, courage isn't just a word. It's a practice. Let me take you back to 3 years ago. That's when I started working with my mentor, Eva. Right off the bat, Eva challenged me to write a list of 100 desires. Desires for my relationships with myself, my family, my friends, my desires around love, sex, career, home, money, fun and adventure, and community and contribution. I made it to 25. Eva said, keep going. Another 25. Eva said, keep going. At 88, I said, all right, Eva, that has to be enough. I can't possibly think of anything else that I want. And Eva said, Kristi, take a breath. I know there's more. You got this. And you know what? She was totally right. I kept writing 92, 95, 98, and then 121 desires. What? 121 things that I want to do, I want to have, I want to be. That was terrifying and liberating because it was maybe the first time in my life that I had let myself fully experience my own voice. I let myself be totally authentic, even when it felt uncomfortable and overwhelming. I go back to that list periodically. It's dynamic. I cross off things that I've done, let go of desires that no longer serve me, and add new desires. Guess what? Starting this podcast on my list of desires. Now, to all my data people out there, you know what I did next? I analyzed my list of desires. I looked for themes, I looked for patterns, and I asked myself, what connects all of these things that I want for my life? I found my 4 guiding values: courage, freedom, connection, and kindness. This is my vision. And on my 50th birthday in 2023, I fully committed to it. I got a tattoo. It covers the entire inside of my left forearm. It's an abstract figure of a woman's body containing those 4 words: courage, freedom, connection, and kindness. I see my tattoo every day. It's my North Star. And in every single moment, I get to reorient myself toward this vision. Courage. It's critical. Courage is the catalyst that moves me out of collapse and into freedom, out of judgment and into connection, out of hostility and into kindness. And since then, I have really leaned into courage. And what's so cool is that courage can look so many different ways. There's courage in the personal and in the professional. There's courage in speaking up and in staying silent. There's courage in taking action and in waiting. Courage can be loud, like a rallying cry, or quiet, like holding firm in your truth. Courage can be precise or intentional, or it can be messy and imperfect. Courage is saying yes when everything in you wants to say no. Courage is saying no when the world expects you to say yes. Courage is stepping forward before you feel ready. Courage is setting boundaries even when it disappoints others. Courage is dreaming bigger than the world told you was possible. Courage is choosing yourself even when you've been taught not to. Courage can be immediate, a split-second decision, or it can be built over years, a slow and steady fire. Sometimes courage is about making history, and other times it's about making it through the day. Courage isn't always what we expect. Sometimes it's just getting up and trying again. Here are some of the things I've recently created in my life as I've let courage be my catalyst. I was fully present for my mom's final days, and I said goodbye to her. I've rebuilt my relationship with my dad to be more real, more vulnerable, and more true. I am confronting the intergenerational trauma in my family head on, no more looking away. I fought for and got my daughter the mental health support that she has needed for years. After 3 decades of trial and error, I finally found the right medication for my chronic anxiety and pain, both of which are negligible now. I built my own business, my vision, my way. And after years of working from home, I'm renting my own office space, and I absolutely love it. I'm writing my story, my memoir, my truth, my legacy. And beyond those big moments, I'm dancing, even when no one else is dancing. I am notifying rather than asking permission. I'm not always taking the bait. I'm trusting myself. I'm embracing my no, and I am equally embracing my yes. I'm choosing embodiment and pleasure. I own my shit and let others own theirs. I am loving myself, especially when I screw up. I'm leaning into abundance. I'm taking up so much space. So why a podcast about public health? Public health has always been close to my heart, but like many of you, I didn't start here. I didn't start in public health. For me, it all began with playing math games with my dad in the car as a little girl. One of my favorites was to take turns counting in binary numbers as high as we could go. That love of numbers became a love of patterns and solving complex problems. Applied mathematics felt like the perfect fit for me. But the key question was, how did I want to apply it? Then during my senior year of college, I got to use my math skills to model the transmission of HIV, which opened my eyes to epidemiology and public health. And suddenly I saw it, how math and numbers tell stories, how data isn't just abstract. It's about people and communities and lives. I went on to get my MPH and then my PhD in epidemiology. And after that, I never looked back. Public health fuels so many of my passions, using data and analysis to uncover meaningful insights, communicating health information in ways that empower people, making an impact on communities through science and policy, advancing equity in a field where it is too often an afterthought. Public health is built on science, data, and policy, but at its core, public health is about courage. Courage is speaking truth to power. Public health professionals are often the ones naming hard truths about inequities, systemic failures, and gaps in care. It takes courage to push for policies that protect marginalized communities when political, economic, and institutional forces push back. Courage is standing firm when the work gets difficult. Public health isn't about quick fixes. It's about long-term, generational change. This means staying committed even when progress is slow, when funding disappears, or when resistance comes from those in positions of power. It also means navigating mistrust in institutions and policies, whether from historically underinvested communities or from those spreading misinformation and disinformation to undermine public health efforts. Courage is leading with integrity. Public health professionals navigate competing interests, misinformation, and bureaucratic barriers. It takes courage to stand by evidence-based practices, to fight for ethical decisions, and to hold institutions accountable. In a time when harassment of public health officials is rising, standing firm in the pursuit of diversity, equity, and inclusion takes even more courage. Courage is being adaptable. The landscape of public health is always shifting. New diseases emerge, the policies change, crises unfold. It takes courage to adapt, pivot, and step into uncertainty, knowing that decisions made today impact lives tomorrow. The increasing threats to public health, whether they're from pandemics, they're from climate change, or social determinants of health, demand leaders who are willing to act boldly despite uncertainty. Courage is protecting our own well-being. Public health is a profession built on service, but courage also means knowing when to step back, set boundaries, and preserve our energy so we can continue the work in a sustainable way. In a field where burnout is so common, courage means recognizing that self-preservation is not selfish, it's actually necessary. Because at the end of the day, courage isn't just part of public health, it's what makes change possible. Okay, so why a podcast for BIPOC women? I've spent much of my public health career working in collaboration with BIPOC communities, not as an outsider prescribing solutions, but by listening, co-creating, and working alongside the people most impacted by health inequities. In the Ninth Ward of New Orleans, I work directly with those impacted by the HIV epidemic, conducting partner notification and STI contact tracing. In Madagascar and Haiti, I collaborated with female sex workers to create evidence-based STI treatment guidelines, ensuring that the policies affecting them were shaped by their voices and not imposed upon them. In Albany, New York, I developed and ran 2 positive youth development programs with a public health flavor for inner city teens, recognizing that public health is as much about opportunity and empowerment as it is about prevention. And in San Mateo County, California, I led an evaluation of programs offered through the Office of Diversity and Equity, identifying what was working, what wasn't, and where change was needed. This work isn't just professional, it's personal. My husband is from India. Our daughter is mixed race. As she enters adulthood, she is navigating systems that were not built with her in mind. That's not just a fact, that is a call to action. And many of the most courageous people I have ever met are BIPOC women working in public health. So to all the courageous Black, Indigenous, and women of color working in public health, this space is yours. This space centers your voice. This space celebrates your passion. This space amplifies your courage. Each week, we will have real, unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We'll talk about the authenticity and the vulnerability and the courage that you bring, not just to public health, but to every part of your life. Because courage is about action, even in fear. It's about taking up the space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. So if you're ready to turn up the volume on your courage, if you're ready to take up space, if you are ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, follow this podcast and join me in the next episode of Courageous Public Health. Until next time, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.